get that question a lot, and usually I start to answer this way: we have become ahistorical, and that is why I began with 1619, but I go back beyond that to 1492, and that was when the Spanish explorers landed in what was then called Hispaniola. The result of that landing was 600,000 indigenous people died, which I would equate to genocide. They were replaced by African slaves who were brought in to work in the sugarcane plantations. So then when we just think about the beginning of the transatlantic slave trade, that is the epitome of social distancing. That is the epitome of what happened as it relates to disparity subsequent to the transatlantic slave trade. And then when we move forward through history, then I would say that the canary in the coal mine as it relates to healthcare delivery for Black and Brown people was already on life support before COVID hit. And all those years of disparity in treatment and equities in treatment led to the near death of a canary in a coal mine. And we look at the data, that's life expectancy, that's complication rates, it's readmissions, it's clinical outcomes, it's patient safety, it's the patient experience, and it's the effectiveness of care that existed pre-COVID. We also knew then pre-COVID that there were populations of people in this country that had not just been devalued, they had been dehumanized. The next thing then that we knew about that was a canary in the coal mine before COVID was there was already a resource allocation of people, supplies, equipment that was unequal before COVID. Those are known knowns. So then I say to people, why would you be surprised that the death rates for Black and Brown people, indigenous people, people in long-term care facilities, people who are incarcerated, why are we now somehow surprised that COVID caused this? COVID did not cause it. It was a pre-existing set of conditions that was exposed by COVID. So now as we rush to say, well, COVID has something to do with this, COVID is just the next thing that happened. We can go back through history again to multiple outbreaks and catastrophes that impacted primarily and unequally Black and Brown people. So COVID is just the latest. So my hope then is that we look at this and say, we need to understand the history that led us to this point. We need to understand how we need to value all people, not just people that have insurance or people that have white skin. And we also need to recognize that there are low-income populations, Black and Brown populations across this country that were under-resourced before COVID. So this is the opportunity we have now in all phases of healthcare delivery to address the gaps that existed prior to COVID.